Hi, and welcome to OneMedicine. Today I'll talk about cervicitis. Cervicitis is the inflammatory response in the cervical epithelium and the stroma. So there'll be some inflammation in the cervix seen in cervicitis. There's also presence of mucopurulent discharge at the external os. That's how we make out that the patient has cervicitis. There'll be presence of this mucopurulent discharge, which is seen at the external os. Sometimes there'll be easily inducible endocervical bleeding also, which is called as easy friability. Sometimes there can be edema of the cervix also. So if all of these findings are present, then we say maybe the patient has got cervicitis. The factors which influence cervicitis are the age of the patient, parity of the patient, hormonal status. That is, if the patient has got increased estrogen, then there'll be increased glycogenation, maturation, and desquamation. Progesterone will inhibit maturation. Etiology of cervicitis, we have got non-neoplastic and neoplastic etiologies. Under non-neoplastic, we've got infectious and non-infectious etiology. Infectious etiology is the most common cause for cervicitis. Among the bacteria, the common causes are Neisseria gonorrhea and Chlamydia trachomatis. Viruses, herpes simplex and human papillomavirus, that is HPV virus. Fungi will be Candida species. Parasites will be Trichomonas vaginalis. So these are the common organisms which cause cervicitis. The uncommon bacteria are donovanosis, syphilis, and tuberculosis. That is, any STD also can cause cervicitis. Other viruses are cytomegalovirus. Fungi would be Aspergillus, coccidioidomycosis, paracoccidioidomycosis. Parasites other than Trichomonas vaginalis, it can be Enterobius vermicularis, Entamoeba histolytica, and schistosomiasis. So these are the other parasites which can cause cervicitis. The non-infectious etiology, the common ones being contact dermatitis to spermicidal jellies to condoms. If the patient is allergic to condoms, then post irradiation, post biopsy, and frequent douching can cause cervicitis. Frequent douching will affect the vaginal epithelium and the pH of the vagina and the cervix as well, and that's why it can predispose the patient for cervicitis. Uncommon etiology, non-infectious, would be endometriosis, vaginal adenosis, pemphigus vulgaris, and plasma cell cervicitis. Like the plasma cell balanitis on the male counterpart, females also can have plasma cell vulvitis, and that is a female counterpart of the Zones balanitis or plasma cell balanitis. Neoplastic etiologies like carcinoma in situ and squamous cell carcinoma, and other one is non-Hodgkin's lymphoma. These are the common etiologies for cervicitis. Clinically, we see in the patient can be completely either asymptomatic or patient might have varied presentations. Abnormal vaginal discharge of varied color and consistency with abnormal bleeding, which is mostly post-coital bleeding is seen. Along with that, there can be dysuria also present. On perspicuum examination, perspicuum examination is a must in a case of cervicitis to see how the cervix is looking. There can be mucopurulent discharge, which can be seen at the external os, and cervical erosions and ulcers can also be present at times. So in cervicitis, if it is caused by herpes simplex virus, so if it is herpetic cause, then you can see small grouped erosions with well-defined borders. So small multiple grouped erosions with well-defined borders would be seen, and these would be very painful lesions if it is herpes simplex virus. So if the cause is syphilis, then there will be clean looking punched out ulcer which can be seen. Okay, clean looking punched out ulcer would be seen. If it is Trichomonas vaginalis, there we would see inflamed mucosa with punctate hemorrhage. Mucosa would be inflamed with punctate hemorrhages, that is the strawberry cervix would be seen, and which is accompanied by profuse malodorous frothy vaginal discharge. There will be also vaginal discharge along with the cervix looking like this. These are the important causes of cervicitis and how they would look on perspicuum examination. Diagnosis for Neisseria gonorrhea, Chlamydia trachomatis, and Mycoplasma genitalium, swab test can be done. That is, a cotton swab can be taken, and the color of the swab can be taken. If it is Chlamydia trachomatis, there will be bleeding, easy friability would be there. So you can see the blood on the swab. If it is Neisseria gonorrhea, yellowish mucopurulent discharge would be seen. That would be like that. And smear gram staining also can be done to see the organisms. Nucleic acid amplification test is another important test and is one of the preferred tests that is most commonly done and most preferred test, and that will give a definite diagnosis. For Trichomonas vaginalis, wet mount has to be done, and this is the only case wherein we do wet mount, and wet mount is very important to diagnose Trichomonas vaginalis, wherein we see this organism, pear-shaped organism present with jerky motility, organism would be present, okay? So that is corkscrew or jerky motility that the organism shows. And then if you want to do culture, then in pouch culture can be done. Other newer tests are OSOM, Trichomonas rapid test, and Affirm VP3 tests. These are not usually done. Wet mount is what is preferred, and in that you can see the jerky motility of the organism. If the cause is herpes simplex virus, then speculum examination will tell you well-defined erosions, multiple painful erosions with mucopurulent discharge. For the virus, we can also do cell culture and polymerase chain reaction. ELISA can also be done to know the diagnosis. Certain complications of the cervicitis, it can cause ascending infection of the from the cervix. The infections can spread. It can go beyond the cervix. It can go beyond the cervix, so it can spread to the endometrial cavity, fallopian tube, peritoneal cavity, causing peritonitis also. Okay, if it causes peritonitis, that's a grave condition again. Again, it can cause endometrial abscess and endometrial adhesion bands and problems in pregnancy. To conceive, there can be problems. Conception can be an issue then. Reduced fembrile motility. So inside the fallopian tube also there can be adhesions and blockages, which can again cause a problem in conception. If the patient is pregnant, it can cause chorioamnionitis, premature rupture of membranes, and preterm labor also, because cervical length would be reduced and there would be infection there, which would aggravate all of these conditions. Pelvic inflammatory disease also can be one of the other complications. The treatment again depends upon the cause, so diagnosis is very important. If the cause is Neisseria gonorrhea, then ceftriaxone 250 mg single intramuscular dose would be enough. Most commonly what happens is Neisseria gonorrhea is seen along with chlamydia trachomatis. So whenever you're treating for Neisseria gonorrhea cervicitis, it's better to treat for chlamydia trachomatis as well. So combining both of them is what is advised, and that is a better treatment option. If the cause is chlamydia trachomatis, doxycycline 100 mg twice daily is given for 7 days. So for 7 days we give 100 mg BD of doxycycline is preferred if the cause is doxycycline. Okay. Or otherwise you can also go for azithromycin 1 gram orally single dose. Just 1 gram single dose of azi can also be given. Chlamydia vaccines are being prepared and they are still under trial and they are to be introduced in the market. If the cause is Trichomonas vaginalis, that is on wet mount, you see the jerky motility. If you see that, then oral metronidazole can be given. 2 gram single dose of metronidazole is enough for that. So that is a treatment for Trichomonas vaginalis. If it is Mycoplasma genitalium most commonly causes non-gonococcal urethritis. That is what it usually causes, but it can also cause cervicitis. So if it causes, then azithromycin or moxifloxacin 400 mg daily for 10 days can be also tried. If the cause is herpes simplex virus, so herpes simplex virus is not an antibiotic. You have to give antiviral for this, right? You should give acyclovir 400 mg TID 3 times a day for 7 to 10 days. Famciclovir 250 mg TID, valciclovir 1 gram BD can be given. So all of this, if this is the first episode, you should give it for 7 to 10 days. But if it is a recurrent episode, the same dose would be given only for 5 days. Okay. And if the patient has got more than 10 episodes in 1 year, for per year has got 10 episodes, then you have to start suppressive therapy. So for herpes simplex virus, we have the active therapy, then we have the recurrent therapy, then we have the suppressive therapy also. So suppressive therapy, for example, here we'll give acyclovir 400 mg BD. For like 6 months or 1 year continuously we'll have to give to suppress the virus. So that is if the patient has got more than 6 to 10 episodes per year, then we go for the suppressive therapy. Otherwise, for the acute infection, only 7 to 10 days is what is preferred. Treating sexual partners again is important. You have to raise all the partners, and irrespective of the time of the last sexual contact, you have to treat them. Abstinence has to be followed, and follow-up of both the patients as well as their sexual partners is what is advised. That's about cervicitis.